Hey everybody, I'm at Weiler Plastic Surgery in Denham Springs, and today I'm getting laser hair removal. Now there's lots of different places on the body you can obviously get laser hair removal. For me, I'm doing it under the arms. Again, this is for men and women. So guys, don't be afraid of this as well. I've never had this done before. I'm not scared, so you'll do this with me, you'll watch. I'll talk you through what it feels like. I know I'm in good hands here at Weiler Plastic Surgery. So here we go. So I'm back in the exam room. I'm with Dr. Weiler and with Crystal, and we are ready to go. So there was some prep involved prior to me getting here, Dr. Weiler.
Yes.
What were the instructions that you all gave me?
Sure. So we contacted you probably a few days before, right?
Yeah.
We've asked you to not be exposed to any sun for the first 7 days, roughly 5 to 7 days before, 5 to 7 days afterwards.
No laying out like this.
No laying out like that. We don't encourage you laying out like that anyway.
I don't.
We also asked you to shave about
Yeah.
48 hours before.
Okay.
We do want a little bit of hair stubble for the device to sort of catch on to and activate. We also asked that you stopped any sun-sensitive medications like antibiotics and things like that.
Check, check, and check.
Good. So
Okay.
I think we are ready to go.
Ready to go. So
Yes.
Crystal is going to actually prep me for the
Yes.
procedure.
Yes, so she
Okay,
can do a little
so
prep work.
lay
So
back,
she's
arm
gonna raise your arm, exactly. She's gonna clean you with something called HIBA cleanse. And typically our patients are in a robe or a little bit more undraped, but we're not gonna expose you here.
I'm doing it fancy today.
Exactly, doing it fancy, exactly. Hopefully we don't ruin your blouse today. So she's gonna clean you with some HIBA cleanse, which is a soap. And then she's gonna apply some gel. This is an ultrasound gel that's gonna give us a good contact between the device and your skin. And I'm gonna start the process of laying you back here. So she's placing this ultrasound gel in position over your arm. All right, we've got, we're gonna cover the whole area. This is gonna allow a contact between the device and your skin.
Feels
Okay.
nice and cool.
Yep. And then do you want to keep her in this position to do it real quick, or you want to lay her back? Or I think we're appropriate. No? Yeah, we'll do it just like this, okay? If you're all right.
Yeah.
And so Crystal's going to turn the device on.
So what actually is the device doing?
Right, so the device is, so your hair has a pigment in it. So candidates for this procedure are patients that have darker, coarser hair.
Okay.
Patients, there's all types of hair, there's all types of skin sort of colors out there. And we tell patients is that what we like is the best candidates are fairer skin with darker hair.
Okay.
Now, we can do all skin types. We have devices, different lasers or wavelengths for all devices and all of our patients. But the best candidates are the darker the hair and the lighter the skin. So the only patients that we can't treat are patients with really fair blonde hair, which most patients don't have. So some patients do have that on their face. But we have different procedures for that also.
Okay.
Okay. And so she's going to apply the device. It will cool your skin as it works.
Okay. I'm going to talk through sensations.
Exactly. Talk to it, relax, talk to the
Okay.
sensations. I promise you it's not going to hurt.
Oh, that was nothing
It's
at
not
all.
bad, right?
No.
Good, good.
Just feels like a little, sort of a little pop.
A little pop, exactly.
Yeah.
And what this device is doing, so it's laser energy, and laser is light, and the light energy is focusing in on the pigment in the hair. Does that make sense?
Okay, yeah,
And so
yeah.
it's ablating or destroying the hair.
And then is this permanent, Dr. Weiler?
Great
or
question. So
I'd love to not be able to shave for the rest of my
so
life.
we typically tell patients, so hair grows in different cycles, right? And there's
Yeah.
lots of different cycles throughout the year. And so we recommend about 6 to 8 treatments, all right? We have an unlimited hair laser removal program during a year. You come in for multiple treatments to get the hair during all the different cycles, okay? And then we do tell patients it's reduction, significant reduction, okay?
That's a plus.
It's a plus. And then you will need a little bit of maintenance over the next couple of years, maybe 1 to 2 treatments every year or 2, something like that.
Okay.
And the longer it goes, the less that you need. Is that going to make
how
sense?
long on each arm? So that was nothing. It was
Correct.
just like almost a, like
It
I
is
said, a
literally
little
a
electro pop
30-second procedure
Wow.
on the underarms.
So I basically can go back to work right
Yep,
after
you
this.
can walk out the door and go right back to work.
So if you're watching out there, it's nothing.
Yep.
The cool gel helps with a little sensation, and you don't feel much at all.